If you've just been diagnosed with gout, I get it. It can feel really confusing, maybe even a little scary. That sudden, intense pain is a shock to the system. So the whole point of this guide is to cut through all that confusion and give you a clear, straightforward plan for taking control. Let's start with that first, unforgettable experience.
My feet were on fire. Wow. That's how one patient, Ken, described his first gout attack. And if you're watching this, I'm guessing that feeling sounds all too familiar. It's a powerful, unforgettable kind of pain, and it's really the starting point for understanding what's going on.
So let's talk about that first attack. It often feels like it comes completely out of the blue, right? A lot of times it happens at night, and the intensity is just shocking. Let's break down what that experience is all about and why it happens.
What's pretty remarkable about a gout attack is just how specific the symptoms are. It usually goes after one joint at a time, the big toe being the most famous target. The joint gets hot, it swells up, it turns this angry reddish-purple color, and the pain, well, it's on a whole other level. It's so sensitive that literally the weight of a bed sheet can feel unbearable. This isn't just a little ache, it's a full-on inflammatory assault.
Okay, so you've survived that first awful flare-up. The very next step is getting a proper diagnosis. Because while your symptoms might be screaming gout, your doctor will want to run a few tests to be 100% sure and to rule out anything else.
Your doctor has a few tools in their toolkit to figure this out. First up is a blood test, which checks your urate levels. They're often high in people with gout. They might also do a scan, like an ultrasound, which can actually see the little crystals hiding out in your joint. But the real gold standard is the synovial fluid test. It sounds a bit intense, but a doctor uses a needle to draw a tiny bit of fluid from the inflamed joint. And when they look at it under a microscope, they can see them, the telltale needle-shaped crystals that are causing all the trouble.
All right, you've got the diagnosis. But what is gout really? What is actually happening inside your joint to cause that unbelievable pain? To get that, we need to zoom in and look at what's going on at a microscopic level.
At its heart, gout is a type of inflammatory arthritis. The whole thing is caused by having high levels of a substance in your blood called urate. When there's too much of it for too long, it starts to form these tiny, sharp crystals.
And here you can see the root of the problem. For years, these little needle-like crystals can be building up silently inside the cartilage. But when they get disturbed and spill out into the joint, they physically scrape and irritate the soft lining. Your body's immune system sees this and launches a massive counterattack. That's the inflammation you feel, the heat, the swelling, and that absolutely excruciating pain.
Now, this is a really crucial point that surprises a lot of people. There's this myth that gout is all about eating rich food. But the science is pretty clear. Only about a quarter of the urate in your body actually comes from your diet. The other 3/4, your body just makes it naturally. For most people, gout happens simply because their kidneys aren't quite as efficient at flushing that urate out as they should be.
So, while diet isn't the root cause, certain things can definitely trigger an attack, kind of like shaking up a snow globe and letting all those crystals fly around. This could be anything from an injury, getting sick, or, yeah, a big fatty meal. Even just getting dehydrated can do it. And here's the wild part. Even starting the right medication to lower urate can trigger a flare-up at first. We'll get to why in just a minute.
Okay, so how do we fight back? The good news is, treatment for gout is very effective. It's best to think of it as a two-pronged attack. One plan for when you're in the middle of a flare-up and another for long-term prevention.
For that sudden attack, the goal is just rapid relief. We're talking powerful anti-inflammatories like NSAIDs, colchicine, or steroids. But for long-term control, the goal is totally different. We use medications known as urate-lowering therapies, or ULTs, things like allopurinol or febuxostat, to get to the root of the problem.
When you feel a flare-up coming on, speed is everything. The faster you can get that prescribed anti-inflammatory medication in your system, the better. And at home, your job is to help it along. Prop up the joint, rest it, put an ice pack wrapped in a towel on it to calm the swelling, and do whatever you have to do to keep anything from touching it. The long-term prevention plan is all about changing your body's chemistry. You take a daily medication like allopurinol, which tells your body to produce less urate. Now, this isn't a quick fix, it's a lifelong therapy. And don't be alarmed if you have more attacks in the first 6 months. I know, it sounds crazy, but that's actually a good sign. It means the medicine is working, dissolving those old crystals, which can stir things up for a bit. You gotta stick with it.
So, medication is absolutely the cornerstone of managing gout, but your daily habits are a super powerful ally. Making smart choices can support your treatment,
help you avoid triggers, and just improve your health all around.
When you think about diet, think swap, not stop. You don't have to give up everything you enjoy. It's really about moderation. So maybe try swapping out some red meat or certain types of seafood for awesome plant-based proteins like beans and tofu. Moving towards a more balanced, Mediterranean-style diet is just fantastic for gout and, let's be honest, for everything else too. This might be the simplest and most effective thing you can do every single day. Drinking plenty of water, aiming for around 2 liters, helps your kidneys do their job better. It helps them flush that excess urate out of your system before it ever gets a chance to turn into those painful crystals.
Now, you'll need to be mindful of alcohol in general, but beer is kind of a double whammy for gout. Not only does it dehydrate you, but it's also packed with purines. That combination can cause a really fast spike in your urate levels, which makes it a very, very common trigger for an attack.
And since the feet are so often in the line of fire, good foot care is a game changer. Look for shoes that have a wider and higher toe box. That just gives your joints some breathing room. And while you definitely want to rest during a flare-up, when you're feeling good, gentle exercise like swimming or walking is absolutely fantastic for your joints and for maintaining a healthy weight.
Managing the physical stuff is one piece of the puzzle. But, living with a chronic condition also has a huge impact on your emotions and just on your daily life. Let's talk about how to manage that side of things.
The fact that attacks are so unpredictable can really mess with your sleep, your mood, your ability to work. It is completely normal to feel anxious or just plain frustrated by all of this. Acknowledging that emotional side is a really important part of taking control.
And this is what it's all about, right? The goal of a good management plan isn't just about stopping the pain. It's about getting your confidence back, getting you back to your life, and doing the things you love without having to worry about that next attack.
So you have to be proactive. Talk to your boss about small adjustments at work if you need them. Really prioritize your sleep with a good, relaxing routine. And please, most importantly, reach out. Talk to your doctor if you're feeling low. Find a support group. Lean on your friends and family. You are not in this alone.
We started with Ken's words about the pain, so it just feels right to end with his words of encouragement. Getting a gout diagnosis is tough, no doubt about it. But with the right knowledge and a solid plan, this is a very, very manageable condition. You have the tools. You are tougher.